Hello and welcome to Lyra.me, and today's video is going to be about tick-borne encephalitis, but not only encephalitis and meningitis in general. And we need to talk about this because as you follow the news lately, we are suffering from an West Nile encephalitis epidemic recently. People have died already in the US and Canada this year because of it, and also in Europe, and that's what makes it a very important subject to talk about in our opinion. And we're not only going to explain to you what encephalitis and meningitis really are, but also show you a natural therapy protocol that really works based on natural supplements, of course, that are side effect free. But before we do that, I would like to remind you again that we're celebrating the redesign and relaunch of our Lyra.me website, and we're doing this by offering you a 10% discount on all orders above $200 for the first 50 orders only, so be quick and take advantage. And with that out of the way, let's dive right in and learn more about encephalitis, meningitis, what you have to pay attention to, and how to treat it holistically. So let's start by defining what encephalitis and meningitis means. Encephalitis means inflammation of the brain. Encephalon literally means the brain. And meningitis means inflammation of the meninges, and the meninges are the inner skin around the brain. And there are specific viruses that can cause encephalitis as well as meningitis, such as West Nile encephalitis, Japanese encephalitis, tick-borne encephalitis, as well as herpetic encephalitis. And encephalitis in general is the last stage of Lyme disease, and Lyme disease patients manifest symptoms of the tick-borne encephalitis, also called TBE for short, after 12 to 24 months of being infected with Lyme disease. And this time is necessary for the Borrelia to spread its DNA specimens, or the viruses. Borrelia lives especially around the head and the neck, and thus these viruses will proliferate in the brain, causing the meninges and the encephalon inflammations that we're talking about. And there are many types of encephalitis viruses. The most common encephalitis viruses are Toga viruses, which is the alpha virus complex. They are spread in the US mostly by mosquitoes. Also, the second one is the flaviviruses, to which also are counted the hepatitis B, C viruses, as well as the tick-borne and West Nile encephalitis. The third category is the West Nile complex that is existent in the US, China, Japan, Russia, Australia, Africa, Latin America, and they also spread by mosquitoes. Tick-borne encephalitis exists also on all continents and are, as the name already suggests, spread by ticks. Then we have Banya viruses that are existing in the US, especially in California, and La Crosse encephalitis, and as well in Europe, that are also spread by mosquitoes. Then we have the flaviviruses. They are existing in Africa and also spread by mosquitoes. Then we have the so-called reoviruses as well as orbiviruses. They are existing in the US, especially Colorado and the Rocky Mountains. Tick fever also called, and is spread by the Colorado tick. And the most common in the US and Canada are the West Nile encephalitis, the tick-borne encephalitis, the St. Louis encephalitis, La Crosse, as well as California encephalitis. The most common in Asia is the Japanese encephalitis, and in Europe the most common one is the West Nile encephalitis. So what are the symptoms that you have to be on a lookout for with encephalitis that can be deadly, as we've already mentioned? Well, the problem is that there are many stages, more precisely two main stages of this infection, and in the first stage you will experience only flu-like symptoms such as a fever, throat problems, coughing, generally feeling ill, aches and pain, weakness and malaise, and therefore it's very difficult to detect in this first phase your infection. You can very easily assume that it's just a normal flu. And then the viruses go dormant, and if you have a compromised immune system, such as if you're suffering from Lyme disease, hepatitis, or Epstein-Barr virus, the encephalitis is going to develop further in your body and stay until an efficient treatment is going to cure the condition. And if the infection becomes severe, the symptoms in the second phase will change severely, when you will experience headaches, confusion, disorientation, photophobia, agitation, optic neuritis, myelitis, personality alterations, as well as seizures, coma, and eventually death, as some people who have been infected right now by the West Nile virus have unfortunately experienced. And depending on which part of your brain is affected, some other symptoms may appear, such as language skill impairments, movement impairments, uncontrollable tremors, partial paralysis, loss of the ability to regulate your body temperature, and so forth. What are the mechanisms of encephalitis? Well, for most types of encephalitis, neural encephalitis, you do not have a standard healthcare procedure in conventional medicine. Of course, the doctors use some types of pharma drugs with more or less success, such as minocycline, immunoglobulin, interferon alpha, and ribavirin, as well as erythromycin, steroids, and anticonvulsant medications, but these, of course, treat mainly the symptoms. We have, of course, different types of encephalitis, as we've talked already about: the Japanese, the West Nile, the tick-borne, the St. Louis, and dengue fever. They are all so-called flaviviruses, and they are closely related to each other, and therefore they show similar symptoms, and the treatment for all of these types of encephalitis and all of these flaviviruses is also very similar. How do you get infected? Well, the mosquito bites you and spreads the viruses into your liver, your spleen, and the lymph system. This takes about 5 to 15 days of incubation, and then the chemicals in the mosquito saliva also downregulate your immune system response, so they downregulate your interferon and the T cells activation. And in this way, the virus can bypass your immune system and can get into your lymph system and spread throughout your whole body. In the lymph, then the viruses start infecting the dendritic cells, your monocytes and your macrophages. And so the viruses start replicating slowly in these cells, and then the dendritic cells cannot mature. And thus, in turn, the T cells activation is also slowing down. The monocytes are acting as carriers and bring the viruses then to the brain eventually. And these viruses release a lot of substances also to make the brain barrier more permeable. Once in the brain, the virus is attached to the neurons, and due to the tropism, the viruses go preferentially to the thalamus, the hippocampus, the midbrain, as well as to the cortex, which are also the most severely impacted parts of the brain. And the peak is reached then after about 60 days. And once those viruses got into your neurons, the viruses begin to replicate, and they stimulate endocytosis, which is an engulfment. So the viral particles attach to the microglia, the brain residential macrophages, as well as to the spinal cord, and they stimulate these cells to release cytokines and chemokines, which is an inflammatory process. And the first immune defense force of the central nervous system is thereby ruined. Astrocytes are also often infected by the viruses as well. Astrocytes keep the brain barrier intact, and provide nutrients to the neurons, and they maintain also an electrolyte balance and repair damaged neurons. So they are very important, and those astrocytes lose their functions and start releasing cytokines such as IL-6, RANTES, and MCP-1. The inflammation synergizes also with the viruses, which use inflammation to their advantages, and the neuronal damage advances and can become acute, leading even up to death, as we've discussed, or chronic with a lot of symptoms, such as the ones that we've described already. So let's talk about the neuronal damages that these viruses can cause. Viruses cause the neuronal damages and finally can lead to the neuron's death. The West Nile encephalitis has a preference for the aging brain, so the hippocampus as well as the thalamus, while the Japanese encephalitis targets preferably the young people's brain. The neuronal damages progress over time, and especially after the age of 50, the symptoms intensify and many new symptoms appear, such as sensorial organs and their functions being impaired, especially your vision, your hearing, and the additional tinnitus, as well as dizziness and vertigo. You also will notice an alteration in your mental status, your cognitive abilities, and your concentration will decrease, as well as your speech abilities. Your memory declines comparable to dementia or Alzheimer. You will notice an acceleration of the aging process. The progenitor cells are not renewing, and that's what causes that. You will notice also a permanent decline of the immune abilities, hormonal and thyroid disorders, as well as an insulin resistance and diabetes even, motoric disorders, tremors, muscle weakness, up to Parkinson and MS, digestive problems, especially related to your liver's functionality, as well as the enzymatic pool, connective tissue damages, cartilageous decay, joint pain and stiffness, all due again to spinal cord viral infection, but also migraines, headaches and neck stiffness, behavioral problems such as depression, aggression, anxiety, lethargy, as well as an alteration of your personality. And not only that, but also hypothermia might appear, photophobia, fever, as well as cardiovascular and cerebrovascular problems. And as you've seen, many of those encephalitis viruses are caused by tick bites. So let's talk a little bit more in depth about tick-borne encephalitis. TBE for short. TBE is seen as a late stage of the Lyme disease. It's similar to West Nile encephalitis, but it has some differences. First, edemas are more pronounced with TBE. Micralgia cells are often necrotic with TBE. The lymph system, especially your spleen and the nodes, are more involved in spreading the infection to your brain. And you will experience acute symptoms such as the flu symptoms that we talk about, but also hyperemia, which is congestion, petechial hemorrhages, inflammatory infiltration, necrosis of the microglial cells, and hyperplastic glial nodules, seizures, fever, as well as vomiting. Lesions are mainly happening in the periventricular regions of the brainstem, including the cerebellum and the reticular formation. The cerebral cortex and the basilar portions of the pons and the thalamus, as well as the olivary nuclei, can also be affected. The perivascular inflammations around the blood vessels and the cerebral interstitial edema are also common. You will experience profuse sweating. Laminar necrosis can also occur. In meningitis is very common. Another difference is that the blood pH moves to a more acidic state, and this strongly facilitates the ability of the TBE virus to infect your body. Okay, so now that we understand encephalitis and meningitis better and to know the symptoms that we have to pay attention to, what can we do which herbs and natural supplements can we use in order to get rid of it? Well, we've developed a very specific natural supplement protocol that I'm going to present to you right now. First, antiviral systemics. So you need to inhibit the neural cells infection as well as the cytokine reduction. And here we have developed a very unique preparation called the Herbesso avini. It's a special vivid extract of different herbs such as Icetis, Lomasium, licorice, Houtunia, Chinese skullcap, as well as ultra pure and pharmaceutical grade DMSO. And you take 1 teaspoon 4 to 6 times per day for a period of 6 to 8 weeks. Then we need to take care of our lymphatic system as well as our spleen and our liver and stimulate them and help them. And here again we have developed a very unique product called Herbesso LLS, which is again a special vivid extract of different herbs such as redroot, alcornia, berber, pinelia, that are again combined with ultra pure DMSO, and the dosage here is 1 teaspoon 4 to 6 times per day for 4 to 6 months. Then we need to take care of our neural cells and protect them and help them regenerate. And here again, Herbesso NPR, a unique product that we've developed specifically for this, a vivid extract of herbs such as kudzu, Japanese knotweed, rhodiola, that are all compounded again with ultra pure DMSO. You take 1 teaspoon 4 to 6 times per day. Then we need to inhibit the HMGM1 especially, and this only goes for if the sepsis is likely to appear, which might lead to death. And here we have a special product called Herbesso SI. Again, a vivid extract of different herbs such as licorice, Angelica sinensis, combined with the ultra pure DMSO. You take 1 teaspoon 6 to 10 times per day for 2 to 4 weeks until the symptoms subside. And these herbs are extracted according to our unique vivid extraction technology to preserve the herbs' bioactive components. Their concentration and bioactivity is therefore several times enhanced compared to any other commercially available herb extract. So this is not your run-of-the-mill herb extract that you can get anywhere else. This is really unique. And on top of that, we have also developed a therapy protocol for specifically tick-borne encephalitis. And here also, of course, we use only natural supplements. And for this tick-borne encephalitis, we add the following specific remedies to support our liver. Greater celandine, which is also known as Chelidonium majus, motherwort, which is also known as Leonorus cardiaca, and Ligusticum wallichi. Those are to support especially our lymph system and our liver. You take also, we recommend to take baking soda to remove all of the acidic waste from your system, and also we recommend to drink ginger root as well as fennel tea and take pancreatic enzymes to reduce the acidosis. Also, you need to eliminate and bind the toxins and antigens using binders such as activated charcoal, pectin, and zeolites. We also add berber pinelia and dandelion root vivid extract to reduce the brain fog, to stop the Herxheimer reaction, to cleanse our liver, our kidneys, and our lymph system, as well as the brain and blood. And here we take 200 milligrams per day, 3 times per day. The MTHFR gene is sometimes called also the detox gene because if you have mutations, your body generates less glutathione, which is critical for detoxifying, and so we need to supplement with methylcobalamin, which is vitamin B12, as well as vitamin B2, B6, and 5-MTHF. And whether you're suffering from tick-borne encephalitis or a West Nile encephalitis or any of the other types of encephalitis or meningitis that I've presented to you, On top of the natural remedies that I've recommended to you already, you need to supplement. You need to support your system in order to get rid of this infection. And here's the general supplements that we recommend. Vitamin D3, 10,000 units per day, plus vitamin K2 for better absorption, vitamin B1, B2, B5, B6, B12, as well as 5-MTHR in folate form. Then we need to support our detoxification process, and here we recommend the following supplements: liposomal glutathione, molybdenum, 250 milligrams per day, also chromium, binders, wobenzym, maitake agaricus, cordyceps, and hericium medicinal mushrooms, as well as beta-alanine. Our digestive tract and our liver also need support, and here we take vitamins B as well as liposomal vitamin C and A. Also great digestive enzymes, pancreatic enzyme, and a unique Herbesso liver support that you can get exclusively at lyra.me, like all Herbesso products that I've mentioned. Then our liver and lymphatic system needs support as well, and therefore we add NAC and acetylcysteine 2 caps per day, and also berber pinealia 200 milligrams per day 3 times per day. Cardiovascular system needs also support, and here we recommend a unique strophantine that you can also get exclusively at lyra.me, 3 milligrams twice per day, as well as magnesium citrate, 3000 milligrams per day, grapeseed extract, 3 caps per day, L-carnitine, 4 grams per day, L-arginine, 2 grams per day, but also quercetin, 2 to 4 caps per day, Q10 or ubiquinol, 2 caps per day, as well as propranolol, 40 milligrams per day. For our central nervous system, to support this, we take DHA and EPA from fish oils and plants, as well as phosphatidylserine, ginkgo biloba, bacopa, S-adenosyl methionine, also known as SAMe, citicoline, 5-HTP with melatonin, vinpocetine, huperzine, and L-theanine. Alright, and I would like to finish this off by talking about how an ideal treatment schedule with the treatment that we've shown you would look like. So here's an ideal day. And keep in mind that this is only a general idea of how you should take those supplements and natural remedies. We are all different, as we know, and therefore I strongly recommend that you consult with us before embarking on any type of therapy. But here to give you just a general idea how you can spread those supplements out during the day. So you wake up, let's say at 7 a.m. You take the binders such as pectosol, the zeolites, or charcoal to detox the die-offs, or you can also take green or ginger or fennel tea. Then at 7:30 a.m. the Herbesso Avini and the Herbesso LSS. Then at breakfast at 8 a.m. the supplements that we propose to you together with the Herbesso NPR. At 10 a.m. the Herbesso Avini again with the LSS Herbesso. At 11 a.m. the Herbesso liver support. At lunch at 1 p.m. the supplements again together with the Herbesso Avini and some salad greens. At 2 p.m. the Herbesso Avini again together with the Herbesso LSS. At 3 p.m. the supplements. It's also great to do some exercise and use an infrared sauna if you have the possibility to do so. 4:30 p.m. again the supplements together with the Herbesso Avini and Herbesso LSS. At dinner at 6:30 p.m. the supplements together with a detox bath and the Herbesso Avini and Herbesso LSS. Vegetarian meals in general, we recommend that you keep animal protein-free diets, organic veggies, eggs, no meat, and dairy products. At 7 p.m. dry brushing before the shower helps, and the lymphatic drainage massage would be great. At 9 p.m. you take again the Herbesso liver support, and at bedtime at 10 p.m. The supplements together with the Herbesso NPR. It's also great to do a coffee enema 2 to 3 days per week, and fasting also works great to help your detoxing process. And as I've mentioned, all of the Herbesso products that we've shown you here together with the strophantine are exclusively available at lyranara.me, and if you are quick because of the redesign and relaunch of the site, we offer you a 10% discount on all orders above $200, so take advantage of that. Links are going to be in the description box below. As I've also mentioned, I highly recommend that you consult with us on the treatment schedule that works best for you and your condition. Please contact us at shop@lyranara.com. I'm also going to post the contact information in the description box below. And with all that being said, I hope that you've enjoyed this presentation. If you did so, please do not forget to like, share and subscribe. And until next time, stay healthy.